I remember sitting with my 86-year-old patient Martha last spring. She came in trembling, clutching her purse with white knuckles. "Doctor," she whispered, "my granddaughter visited yesterday and noticed all the bruises on my arms from those tests last month. She asked if someone was hurting me." Martha's eyes welled up. "She thinks I'm not taking care of myself anymore. Now she's talking about moving me into one of those homes." Martha looked down at her arms, dotted with fading, purple marks from unnecessary blood tests. One simple medical appointment had stolen her independence. That moment haunts me. How many of you watching right now have had a routine checkup turn into a cascade of tests, procedures, and worries? How many have left a doctor's office feeling less confident about your health than when you walked in? If you're nodding your head, this message is specifically for you. I'm Dr. Robert Caldwell. At 91 years old, I've been practicing medicine for nearly 7 decades. I've watched healthcare transform from simple house calls to complex technological systems. I've treated 3 generations of families, and now I'm treating the great-grandchildren of my first patients. But most importantly, I'm experiencing aging alongside you. Every morning I wake up with the same creaky joints you have. I understand what we're going through because I'm living it too. What I'm about to share comes not just from medical textbooks, but from 67 years of watching what actually helps my older patients thrive and what harms them. It's information most doctors won't tell you, partly because our medical system isn't designed to give them time to explain it, and partly because many younger physicians haven't lived long enough to truly understand what matters at our age. Let me tell you about William, who came to me after seeing 3 specialists in 2 months. At 73, he'd gone in for a routine checkup feeling fine. Now he was on 5 new medications, scheduled for 2 procedures, and absolutely terrified about a shadow they'd found on an X-ray. His blood pressure, which had been perfect for years, was now elevated, likely from the stress of all these medical interventions. "Doc," he told me, "I wasn't sick until I went to the doctor. Or consider Eleanor, 78, who had such a bad experience with an invasive screening procedure that she developed anxiety about leaving her home. The procedure found nothing wrong, but it left her with pain for weeks and fear that has lasted for years. The hard truth is that after age 68, many standard medical tests do more harm than good. They can lead to false positives, unnecessary treatments, complications, and honestly, a kind of medical trauma that's rarely discussed. These tests strip away your dignity, drain your bank account, and worst of all, they steal your peace of mind. You see, what they don't tell you is that the human body changes dramatically after 65. Our tissues become more delicate. Our kidneys process medications differently. Our risk tolerance should shift, but most medical guidelines are written for younger adults, then applied to us without proper adaptation. This isn't your fault. No one ever sits down to explain that at our age, the rules of healthcare should change. No one tells you that what protected your health at 50 might actually harm it at 75. In medical school, doctors are taught to be thorough, to test, detect, and treat. But they're rarely taught when to stop testing, when finding something might be worse than leaving it alone. Here's what's actually happening in your body. After 68, your immune system naturally becomes more conservative. It's less reactive to small threats, which is actually a good thing in many ways. Your cells regenerate more slowly, your tissues become more fragile, and perhaps most importantly, your life priorities often shift from longevity at any cost to quality of life and independence. Now, before I share which 5 tests you should approach with extreme caution, I want to be clear. I'm not suggesting you avoid healthcare altogether. Quite the opposite. But there is a smarter way to approach your health after 68, one that focuses on what truly matters for your well-being rather than checking boxes on a standard protocol. I've developed a simple framework that hundreds of my older patients have used to take control of their healthcare. It doesn't cost anything. It can be implemented immediately. And within just 7 days of using this approach, you'll feel a profound difference in how you experience the healthcare system. You'll walk into appointments with confidence rather than anxiety. You'll know exactly which questions to ask, and you'll be protected from the cascade of interventions that harm so many people our age. But first, let's talk about those 5 tests that you should approach with extreme caution after age 68. I'll explain why each one deserves special consideration and how to have an informed conversation with your doctor about them. The first test to be cautious about is routine PSA screening for prostate cancer in men over 70. Now, if you're currently being monitored for prostate issues, this advice may not apply to you. But for men with no symptoms or history, here's what you need to know. The PSA test frequently leads to false positives in older men. Our prostate naturally enlarges with age, which raises PSA levels even without cancer. Studies show that for every 1,000 men over 70 who get routine PSA screening, only 1-2 will avoid dying from prostate cancer, while 30 to 40 will experience serious complications from unnecessary biopsies and treatments. To protect yourself, simply ask your doctor, given my age and the fact that I have no symptoms, is PSA testing likely to help me live better, or could it lead to treatments that might reduce my quality of life? If your doctor insists without a clear explanation of benefit, consider getting a second opinion from a geriatric specialist. The second test to approach carefully is repeated bone density scans if you've already been diagnosed with osteopenia or mild osteoporosis and are on a treatment plan. While an initial scan is valuable, repeated scans every 1-2 years rarely change treatment plans for people over 68 and expose you to radiation unnecessarily. Instead, focus on what really works. Weight-bearing exercise, proper nutrition, and fall prevention. Ask your doctor about testing your vitamin D levels and calcium, which are more actionable measures. Something simple I recommend to my patients is to stand on one foot while brushing your teeth. It strengthens your balance and core muscles, which prevents falls far more effectively than obsessively tracking bone density numbers. The third test to question is comprehensive metabolic panels and complete blood counts when you're feeling well and have had normal results previously. These routine blood tests often identify minor abnormalities that are normal variations for your age but can trigger more invasive testing. Here's my approach. Rather than annual blood work, most healthy adults over 68 can safely get these tests every 2 to 3 years. The exception is if you take medications that require monitoring or have chronic conditions like diabetes. Keep a small notebook where you record your results each time so you can track your own patterns. What matters most isn't whether a number falls outside some standard range, but whether it's changed significantly from your normal. The fourth test to be cautious about is carotid artery screening if you have no symptoms or history of stroke. This ultrasound test looks for narrowing in the arteries of your neck, but research shows that for people over 68 with no symptoms, the risks of subsequent unnecessary surgery often outweigh the benefits. Instead, focus on manageable factors that significantly reduce stroke risk. Maintain good blood pressure control, stay physically active with simple daily walks, and eat plenty of vegetables and fruits. If your doctor recommends carotid screening without a specific reason, ask, how would the results of this test change my treatment plan? Are there risks to finding something that might not ever cause me problems? The fifth, and perhaps most important, test to avoid is low-value cardiac stress testing. If you have no chest pain or shortness of breath, annual or biennial stress tests often lead to false positives in older adults. These false alarms can cascade into invasive procedures like cardiac catheterizations, which carry significant risks at our age. A better approach is to monitor how your body performs during normal activities. Can you climb a flight of stairs without severe shortness of breath? Can you garden or walk around the block? These real-world stress tests provide valuable information about your heart health without the risks of formal testing. If you develop new symptoms like chest pressure or unusual fatigue with exertion, that's the time to consider appropriate cardiac evaluation. Now, let me share with you my simple 5-step protocol for taking control of your healthcare decisions. After 68, I call it the WISE approach: worth, intent, simplify, evaluate, and share. Step 1 is determining worth. Before any test, ask this specific question. If this test finds something, what would be the next step? And would I be willing to take that step? For example, if you wouldn't consider surgery due to other health concerns, it might not be worth. Screening for a condition where surgery is the only treatment. Here's how to implement this. Before your next appointment, write down your personal health priorities. Is maintaining independence your top concern? Avoiding pain? Staying mentally sharp? Having this clarity helps you evaluate whether a proposed test supports or potentially threatens these priorities. A simple technique is to use what I call the 3-envelope system. Take 3 envelopes and label them always, consider, and never. In the always envelope, put cards listing treatments you would always want, perhaps pain management or simple interventions. In consider, list things you'd want to evaluate case by case. In never, list interventions you would refuse, perhaps ventilators or feeding tubes. Share these with your doctor and family members. This takes just 30 minutes to create, but can save years of unwanted interventions. Step 2 is clarifying intent. For each recommended test or procedure, ask, what are we looking for and why are we looking for it now? Good medical care should have a clear purpose, not just be routine or protocol. Here's a practical tip. Bring a small notebook to appointments with 3 columns: test name, reason, and next steps. If your doctor can't clearly fill in all 3 columns for a recommended test, that's a red flag that it might be unnecessary. I've had patients show me this notebook, and I've actually cancelled tests I initially recommended because this simple exercise made me realize they weren't truly necessary. Step 3 is simplify. Research shows that for adults over 68, less is often more when it comes to healthcare. Focus on the interventions with the biggest impact on your quality of life: blood pressure control, fall prevention, appropriate exercise, good nutrition, and maintaining social connections. A practical approach is what I call the rule of 3. Work with your doctor to identify the 3 health measures that matter most for your specific situation. For many of my patients, it's something like blood pressure, physical activity level, and mood. By focusing intensely on these 3 factors, rather than tracking dozens of lab values, you'll likely see greater improvement in how you actually feel day to day. For example, Harriet, my 83-year-old patient, was overwhelmed tracking 7 different health metrics. We simplified to focus on just 3: daily steps, sleep quality, and social interactions. Within weeks, her anxiety decreased, her energy improved, and ironically, all those other metrics we stopped obsessing over improved too. Step 4 is evaluate the source. Not all medical information is created equal. Guidelines for screening. Tests are often created by specialty organizations that may have inherent biases toward more testing. The U.S. Preventive Services Task Force provides more balanced recommendations that consider benefits and harms across age groups. Here's how to implement this. When discussing screening tests, specifically ask your doctor, are there different recommendations for someone my age? What do the U.S. Preventive Services Task Force guidelines suggest? This question alone can lead to more age-appropriate care. I recommend keeping a simple healthcare folder with printed guidelines specifically for your age group. The National Institute on Aging has excellent resources that you can print from their website or ask a family member to print for you. Bringing these to appointments shows your doctor you're informed and often leads to better discussions. Step 5 is shared decision-making. Studies show that when patients over 65 are truly involved in decisions, they often choose more conservative approaches that result in better outcomes. Insist on being a partner in your care, not just a recipient of it. A practical technique is to use the phrase, "let's think about this together," when your doctor recommends something that concerns you. This gentle language acknowledges their expertise while asserting your role in the decision. Then ask about alternatives. What happens if we watch and wait? Are there less invasive options we might try first? Now, let me tell you about some patients who have used this approach and how it changed their lives. There's George, 74, who had been getting annual stress tests for years, despite having no cardiac symptoms. Each time he'd worry for weeks before the test and after. Using the WISE approach, he asked about the necessity of continuing these tests. His new doctor admitted that given his excellent blood pressure, active lifestyle, and lack of symptoms, annual testing was low-value care. They agreed to stop the routine stress tests and instead focus on maintaining his active lifestyle. George told me, "For the first time in years, I don't spend 3 months of each year worrying about my heart. I just live my life." Then there's Dorothy, 81, who had been repeatedly pressured to get a colonoscopy, despite her age and cardiovascular risks that made sedation dangerous for her. Using the WISE approach, she had a thoughtful conversation with her gastroenterologist about the diminishing returns of aggressive cancer screening after 75. Together, they opted for less invasive screening methods. "My previous doctor made me feel like I was being irresponsible," she said. "Now I feel respected as someone making an informed choice about my own body." And finally, there's Robert, 77, who had become virtually housebound due to anxiety following a series of invasive tests that found nothing significant but left him fearful of his body. Implementing the WISE approach, he and his daughter met with a geriatrician who helped him identify which symptoms warranted medical attention and which were normal aging changes. "I spent 2 years barely leaving my apartment because I was afraid. Something was terribly wrong with me," he told me. "Now I know what changes to expect and which ones might need attention. I've started volunteering again and visited my sister for the first time in 3 years." My friends, it's never too late to change your relationship with healthcare. At our age, wisdom should be our greatest medical tool. We've lived long enough to know that peace of mind is a precious form of health, that independence is worth protecting, and that the quality of our days matters more than just their number. Try the WISE approach for just 7 days. Before your next medical appointment, work through these 5 steps. Write down your priorities, prepare your questions, consider which tests truly align with your goals for this stage of life. The difference you'll feel is immediate. Instead of leaving appointments with more prescriptions, more appointments, and more worry, you'll leave with clarity, confidence, and a medical plan that truly serves you. Not just a protocol designed for someone decades younger. Your family will notice the difference. But more importantly, you'll feel it yourself. You'll reclaim the driver's seat in your healthcare journey. You'll make decisions based on wisdom rather than fear. And you'll protect yourself from the cascade of unnecessary interventions that rob so many of us of our golden years. For 70 years, I've watched medicine grow more powerful, but sometimes less wise. Today, you have the opportunity to bring that wisdom back to your own care. You've earned this right through decades of life experience. Now use it to ensure your healthcare serves what matters most to you. If you found this information helpful, please consider sharing it with other seniors in your life. And subscribe to our channel for more guidance on navigating healthcare with wisdom and dignity as we age. Remember, it's your body, your life, and ultimately, your choice. Be well, my friends.